We're going to get a little bit controversial today, which I like. I like controversy. We're going to talk about if it's even necessary to get to the root cause. And the question is, are you being duped by all of these functional practitioners and functional marketing out there? Now, let me start off by saying I am a functional medicine practitioner. And the whole definition of functional medicine is getting to the root cause of the problem. And I get that, but I think we get a little bit too focused on it. And I'm going to call out some marketing schemes and scams that may be occurring on your Instagram feed or your Facebook feed that you're getting sucked into. And the reason why I'm bringing this to you today is because I have so many patients that I work with one on one that have spent thousands on functional, integrative, naturopathic treatments, practitioners, programs, gimmicks to no avail. And then they come to me and we actually get down and dirty and get the job done and get them fixed. So the reason why I'm bringing this up is because, listen, there are many functional practitioners out there who cannot prescribe. And when you're talking about maybe adrenal health or a gut expert, that's totally fine because we can heal your gut with supplements and proper diet and maybe the elimination diet and a GI map test. And let's do this and let's do that. We can heal your adrenals short of you having Addison's or Cushing's disease. We can heal that without pharmaceuticals very, very easily. Sometimes it's changing the timing of your T3 medication. If you're on that, sometimes it's using an adrenal glandular. If you're low, using things like rhodiola, phosphatidylserine. If you're high, and those experts 100% do not need to prescribe in order to get you where you need to be from point A to point B. But if you're listening to this, if you're one of my followers, then chances are you have a thyroid or hormone problem and you're struggling with weight and you're gaining weight and you can't lose no matter what you do. And your hair is falling out, and you have low libido and you have low energy and you're dragging yourself through the day. Now, can there be underlying causes for all of those? Absolutely. But that's the point of testing. So let me go through proper functional medicine protocols. First of all, we test, we don't guess. And I don't mean muscle testing, I mean flat out blood testing. I also don't mean a boatload of functional tests where you are paying out of pocket a couple grand to get all these functional tests done that, I don't know, 8 out of 10 times we can get by looking at your blood that is 9 times out of 10 covered by insurance. Now, if you don't have insurance, that's cool. We just go through Alta Labs. It's super cheap. But if you do have insurance, bonus, all of those tests that we're going to order for you before we start working together are covered by your insurance, or you'll get a copay, right? So you don't need to start off before you see me and we work together with a GI map, a Dutch test, an HTMA, a saliva cortisol, a heavy metals, a toxic mold screen. You don't need all of that in the beginning. If you have it because you already dropped a couple grand on another practitioner that didn't help you, fine, bring it along into the appointment. That's extra information that we can go by, but you don't need it to start. That is my point. We can start with blood. Now we get all that blood work back and we devise a treatment plan. So I'm going to stick in the thyroid and hormone realm here for a second. If you have a thyroid problem, if you come back and you have Hashimoto's that's been going on for years, you have been diagnosed hypothyroidism, but you are on T4 only, or you're on a tiny bit of T3, or you're on NDT that's not working, and your practitioner that you're working with right now is simply not listening to you at all and not hearing that you're struggling with all of these symptoms, then we have to do something about that. And there is no amount of gut healing, adrenal fixing, supplement protocols, dietary protocols that we can do to get your T3 out of the basement. So you're rolling in with a free T3. Oh, wait, once you finally get it tested, you're rolling in with a free T3 of a 2.3, a 2.5, a 2.8, and you have all the symptoms. There is no way that we are going to optimize you without using thyroid hormone replacement therapy. I would be completely, and I've said this in past meetings with my group and past meetings with patients and past podcasts as well. I would be completely out of integrity if I claimed that I could heal your thyroid with either a magic wand or some supplement and diet protocol. It's not going to happen. We need thyroid hormone replacement therapy. That is why prescriptions are part of my package, because it's vital. We need to get you that thyroid hormone replacement because your body's no longer making it. And I use this analogy all the time. I will use it again here. If you were a type 1 diabetic and you needed insulin, would you tell me, I really want to go the natural route? I would really like to do this without medication. I'll be like, okay, cool. You're going to be dead real soon because you need insulin to survive. It's not a choice. Now, with thyroid hormone replacement, you might not need it for long-term. Well, no, long-term survival. Yes. Short-term survival. No. You're going to live a while, but it's going to take a long time for all your organs to shut down, for your thyroid to really, really shut down. If you're in Hashimoto's, that thyroid gland will continue being destroyed. And then eventually you won't produce thyroid hormone. So your heart won't beat, your brain won't function, but you're going to get fat and bald and be tired anyways and lose all quality of life first. But I did a gut healing protocol, Dr. Amy. Okay, cool. Well, your gut's better. And that's definitely going to help with serotonin production because 90% of serotonin is in the gut. That's going to help with your immune system because immunity starts in the gut. It's going to help with some T4 to T3 conversion. So assuming you're on T4 only, you're on NDT, you're making some of your own T4 thyroid hormone, that is going to be better converted in the gut. But we have to remember there are other conversion areas such as the liver, the peripheral tissues, the thyroid gland itself, that they kick in. And it's not just about the gut. I mean, healing your gut's going to solve maybe 40 to 50% of that conversion issue. It's not going to solve all of that conversion issue. This is the time where thyroid hormone replacement has to come in, and it changes people's lives. Now, I've talked a lot about T2, and let's say that you are in a boat. I don't want to discourage you, right? I'm always preaching the message of hope. You have to have hope that things can change. If you are in the boat where you're not in a state where we can prescribe, you're battling with your doctor, you can't, and you know what? There's always a way, because if you want to work together, you can fly to multiple states and be seen there just once a year, and then we can prescribe to you the rest of the year. But, you know, let's just say that you're in a remote area, you can't get on a plane, and you're stuck on T4 only with no doctors that'll listen. Or maybe you're in a different country, right? And we can't prescribe to you, because I have a lot of people calling in from UK and Australia. Lot. Can you take T2 to improve things? Yeah, absolutely. I've talked a ton about thyroid fixer T2. T2 is in NDT. It can actually grab an iodine atom and bind to it, and it can become T3. It will not convert into reverse T3 like T4 does. It will increase your basal metabolic rate. It improves mitochondrial function. There are so many benefits to T2 that you can absolutely add that into your arsenal and get improvements naturally. You can go gluten-free, reduce inflammation, and reduce some antibodies and get some improvement naturally. There are certain things that we can do, but in all complete, total honesty, I would prefer that if you have a thyroid in the shitter, that we actually add in thyroid hormone replacement therapy. You can use the T2 as well, but let's add in some thyroid hormone replacement as well. And then there's just the hormones, right? Then there's the hormones, progesterone, estrogen, testosterone, the GSD hormone, that we absolutely need to replace many, many, many times. So let's break that down. Progesterone. I'm not even going to be able to go through all the benefits of all of these different hormones, but I'll give you the highlights. So progesterone, ladies, is like your best friend. Progesterone comes in and it calms the system down. It reduces anxiety. It helps you to sleep. It reduces water retention. It helps protect your uterine lining. It protects against breast cancer, on and on and on. Estrogen. Estrogen comes in, protects your brain from Alzheimer's. It reduces your risk of breast cancer. It provides vaginal lubrication and helps with vaginal atrophy that happens during menopause. It protects your bones. It helps your hair stay thick. Because if you look at old ladies who are been scared by the medical system to not take hormone replacement, they got like see-through hair, right? They virtually have like this gray see-through hair. That is lack of estrogen. Voice changes as you get old. That old lady voice, that is estrogen. If you take estrogen at an early age, your voice doesn't change. You don't sound like you're 110. So many benefits to estrogen. Also, when you replace estrogen, you help to combat that middle weight gain that occurs in menopause. So you're getting all the benefits over here. But let's not forget about the aesthetic benefits, the collagen and elastin production in our skin. Estrogen is the building block for elastin and collagen. So you take a little bit of collagen protein fixer, you got your estrogen on board, you're taking your progesterone at night. Life is better. People like you more because the classic sign of low progesterone is when your significant other says, why are you being so bitchy? And low estrogen, you're going to have decreased libido as well. You're not going to want sex at all. Your skin's going to be all dry. You're going to be dry. Think low estrogen, dry. Everything is dried out. You're like a raisin. You don't want that. Now, let's keep with those two for right now. Progesterone. Are there topical over-the-counter forms? Yeah. I was just having a conversation today with a patient. She showed me this topical progesterone that she was on, which is fine. I mean, if you can't get it, or let's say you're in the younger category where your progesterone isn't that of a postmenopausal woman, you can absolutely use over-the-counter progesterone. Designs for Health has a avail. I carry it on my store. I believe in it. I love it. It's awesome, but you're only going to get 25 milligrams out of that. To go anything beyond that dose, which our normal doses of progesterone are anything between 50 milligrams and 200 milligrams, oral and topical, but those are compounded or they are micronized oral progesterone that you can get as a prescription literally at CVS or Rite Aid. And yes, it is still in the bioidentical category, or the topical needs to be compounded to get to a higher strength. That is where, guess what? A prescription is required. And there's no amount of fixing your gut and fixing your adrenals and waving a magic wand over your head to get to the root cause that's going to help that. Estrogen. Nothing. There's biased creams, but even that, you really want to dose estrogen with a qualified practitioner because you're going to be crap shooting it if you do over-the-counter biased cream. I highly recommend either topical estrogen, a troche, injectable, or a patch. Never oral. You never want oral estrogen. Now we move on to my favorite hormone, testosterone. So testosterone is your GSD hormone. The benefits are increased muscle mass, lean, sexy muscle, increased libido, although libido isn't just testosterone based, but that's another podcast. You're going to feel stronger. You're going to have motivation, drive, clear thinking. That brain fog kind of lifts. Oh, that brain fog and memory tied back to estrogen as well. So testosterone has so many benefits that, again, if you're rolling in with a total testosterone, ladies, this is for you. If you're rolling in with a total testosterone of an 8, and I've seen it. I've seen people come in with a 3. I've seen people come in with an 8. I've seen an 11. I've seen a 15. Way too low. And that's before even getting into the free testosterone. If your total isn't even there, your free is not going to be there either. So in the free testosterone, I want that in the upper quadrant of that lab value range. Upper quadrant. So I'm sorry, upper half of the lab value range. So you can go about halfway and then up. If your testosterone is literally in the toilet, we need to do what? Replace it. Now, my hormone fixer, personally, it kicks ass. I've seen it move numbers, but it's not going to move a 3 to a 50. Supplements do a ton, but you would literally have to be on it for 6 months to a year before we saw that kind of movement. It's going to improve your energy. It's going to increase your strength. It's going to increase your libido. It's going to protect your skin because it has a saw palmetto in it. The Tonkat Ali actually helps with cortisol and insulin. So it has a lot of other benefits. And I always stack Hormone Fixer with whatever testosterone hormone replacement that we're using for women. I will stack those two together. But testosterone hormone replacement needs a prescription. In fact, prescribers have to have a DEA license. Now, again, I will go down this rabbit hole for 2 seconds. It is ridiculous to me that the government requires a prescriber to have a DEA license and that they put testosterone in the same category as Percocet for prescriptions. Why? Because guess what? Testosterone protects against a variety of diseases. Testosterone protects the cardiovascular system. If your testosterone is low, you are at a high risk of cardiovascular disease and stroke. If your testosterone is low, you're at a higher risk of autoimmune conditions coming on. We see this with Hashimoto's. That's why Hashimoto's hits women more than men. Men naturally have a higher level of testosterone, which protects them against autoimmune conditions. Women have a naturally lower level of testosterone, hopefully not that low, like a 3, but they have a lower level of testosterone, which decreases their risk of autoimmune conditions. So that's why we see Hashimoto's go hello in that female population all the time. All the time. One little stressor, it's like the feather floating down on the pile, and then whoosh, it just all disappears. It all crashes down. That's you with low testosterone and a stressor. Pregnancy, perimenopause, menopause, divorce, death, change of job, moving, all that good stuff. All that fun life stuff that occurs. That's just enough to flip the switch on autoimmune if you don't have enough testosterone to protect yourself. So tons of benefits with Hormone Fixer, but we have to pair that up with testosterone. I know I did go down a tiny little rabbit hole, but that to me is why you have to have a DEA license to prescribe testosterone, because the powers that be run by big pharma is keeping that testosterone out of your life. So that maybe you need the statin and the BP medication, and definitely the antidepressant, because testosterone is just has a huge improvement on your mood, as does estrogen and progesterone. Remember, progesterone calms you down, reduces anxiety. Estrogen comes in, improves your mood, improves brain function. Testosterone comes in, improves your mood, balances your mood. Do not think of it as, oh, I'm going to get aggressive. No, you're not. I mean, if you're taking super physiological doses of testosterone, maybe. You're not going to you're fine. You're going to be fine. It's actually going to improve your mood. So testosterone comes in, does all this. We need to prescribe it. You can take Hormone Fixer all day long. There are some great test boosters on the market. I have a men's test booster out now. Fedosia is phenomenal. Turkesterone is great for guys. Hormone Fixer is great for girls, ladies. But occasionally you need that prescription. So again, we come back to this root cause thing, this natural hormone model, these practitioners that are marketing the people that you can come off your thyroid meds. Actually, a patient just told me that the other day. She got an email that you can come off your thyroid meds with my method to heal your thyroid naturally. I'm like, okay, you want to try that? Who wants to try that? Who's optimal right now and actually wants to give up their thyroid medication that is helping them to stabilize their weight, helping them to lose weight, helping them to feel good, helping them to have brain function, reducing joint pain, growing their hair, allowing them to sleep. You have better skin. Your eyebrows grew back in the outer corners. Maybe your eyelashes grew back. The bald spot on your head grew back. You want to give that up just to come off your thyroid meds? Cool. Let me know how that goes. It just basically drives me crazy. And I have a couple other podcasts calling out functional practitioners because honestly, as I see this happen over and over again, it pisses me off more and more. And I know why they're doing it. And that's why I'm calling it out to you all. Because, I mean, I wouldn't call them colleagues because I don't practice out of integrity. So they are acquaintances in the health space, I'll say. And I'm calling them out. I'm calling them to the carpet right now. I am calling bullshit on their marketing. Because when it comes to thyroid and hormones, you better be working with a thyroid expert. You better be working with someone that does bioidentical hormone replacement. And I'm not talking about walking into a clinic and sticking a pellet in your ass. I'm talking about people who sit down and care for you and actually look at your numbers and make adjustments to those hormones where it's not a one size fits all deal. You better be working with them. And you're not just going to walk in to a functional medicine clinic or an integrative doctor or a naturopathic doctor and think that you are going to get the help that you need, because you are being duped by brilliant marketing. And I am calling it out right now. I see the behind the scenes. I see how these people build their marketing plan. And I personally refuse to dupe you. I am not going to lie to you and blow sunshine up your bum and tell you that with a change of diet and just these supplements and my protocol over here, I'm going to heal your gut and everything will be better and you'll get your life back. Bullshit. It's complete and total bullshit. And no, I didn't wake up on the wrong side of the bed today. I've been planning this out for a while. And I've been telling you guys that I am going to record a podcast that actually absolutely calls to the carpet these functional practitioners and these functional programs that are marketed to you, the consumer, to buy into. So I hope you take this to heart and really look deeply before you spend your money and before you decide to work with somebody. If you know or think that you have a thyroid problem, you find an expert. You come to me or you find an expert in this area. Just because someone has functional in front of their name does not mean you should go to them. I'll give you one last story. Just even today, I was messaged by another doctor who has a huge practice and wanted to know if he could refer patients to me for help with their post-concussion syndrome. I was honest with him. I said, that's not what I do. I deal with thyroid and hormones. I would gladly refer him to somebody else, another colleague of mine that specializes in post-concussion syndrome, but that's not me. If you find a functional clinic that does everything, that means they do nothing well. We can't treat every single condition because not one person can be an expert in everything. So if you know that your hormones are off, if you have all of those symptoms, if you've been listening to me for a while, you know what all those symptoms are. If you know you have a thyroid problem and you're not feeling well, if you can't lose weight, if you're gaining weight, if you're tired, if your hair's falling out, if your eyebrows are falling out, if you're just not well, then we need to dive deeper and get you on the right path and not sprinkle fairy dust on your head to heal you. Okay, I lied. One last thing, I promise. I want to touch on the underlying infections because many of you are going, well, the root cause could be I have EBV, I have Lyme, I have mold. Yeah, those contribute, but I have never, and what am I on? 27 years of doing this? I have never seen a case where we can completely eradicate, which is almost damn near impossible, your EBV. We can put it into remission. We can lower the antibodies. We can get it out of the active state. We can do some mold detox protocols. We can do heavy metal protocols. But thyroid, it's still there. You still got that low T3. Did taking the burden off your body maybe reduce your reverse T3? Yeah. If you have an underlying infection, absolutely reverse T3 can go up. But we're not going to magically heal you without that thyroid hormone replacement therapy. And guess what? EBV and heavy metal and mold and Lyme have nothing to do with you going into menopause and your hormones going in the tank. That's going to happen. It's called age and time. Might happen earlier for some due to certain conditions. If your thyroid's in the toilet, yep, it's going to mess up your hormones. So you might see those go into a menopausal state in your 30s, early 40s, for sure. But again, Healing your Epstein-Barr virus and curing your Lyme disease and reducing the heavy metal burden will improve your symptoms, but they're not going to bring you to the finish line. So do not be duped by functional, integrative, naturopathic marketing.